Migraine sometimes fits nice and easy in a box, and sometimes it can be very straightforward to diagnose. There are symptoms and classic features of a migraine that can be helpful, but sometimes migraine isn't as straightforward. Some of the more classic features of a migraine may be the headache originating in a certain portion of the head or having a pulsating or throbbing type quality. When we're talking about headaches that probably are misdiagnosed oftenly, it's sinus headaches. So a lot of people say, "Oh doctor, I suffer from sinus headaches. I feel pressure behind my eyes, I feel fullness behind my frontal head." But they've actually done studies on this, and 90% of people that self-report sinus headaches actually are suffering from migraine. The most common trigger is probably stress for people. I mean, most people can identify that as a trigger, but for some people it's maybe red wine or dark chocolates, and there's a whole number of triggers, and we could talk about those during the visit as well. If someone hasn't been evaluated for their headaches of any kind in the last couple of years, I would challenge them to get with their primary specialist or see a specialist like me and let us ask the right questions, because truly there are treatments now that spare people sometimes from the brain fog or the tendency towards weight gain, the fatigue, and those can be really aggravating for a patient.